Lambert-Eaton myasthenic syndrome, LEMS, know your antibodies. Antibodies play an important role in the diagnostic journey for LEMS and other neuromuscular conditions. Did you know that around 58% of patients were first diagnosed with a condition that presented similarly to LEMS before receiving an accurate diagnosis? Because of its similarity to other diseases, LEMS can be difficult to diagnose, and it can take some patients years to correctly identify their condition. One study found that it took patients with LEMS more than 4 years to receive a correct diagnosis. Often this can come down to a more thorough assessment of antibodies. Why are antibodies important? Antibodies are proteins naturally produced in the body as a defense to what the body sees as foreign or invading organisms. The immune system makes antibodies that target tissues selectively and can sometimes mistakenly attack healthy tissues, causing damage to nerves. Individuals with LEMS have voltage-gated calcium channel VGCC antibodies and experience an impaired release of acetylcholine, ACH. Acetylcholine assists in the contraction of muscles. This impaired release leads to muscle weakness and other symptoms like drooping eyelids and difficulty swallowing. Which antibodies are associated with LEMS? There are two primary antibodies associated with LEMS. These are PQ type and N type VGCC antibodies. Through a blood test, more than 85 to 90% of LEMS patients show an elevated PQ type VGCC antibodies. These patients are considered seropositive. Those patients who do not show signs of PQ type antibodies can still have what is called seronegative LEMS. How can I best confirm if I have LEMS? Due to varying antibody results, those individuals who are seronegative are at a higher risk of being misdiagnosed with conditions presenting similar symptoms such as MG that attack the neuromuscular junction but have different antibodies. More than 1/3 of LEMS patients were initially diagnosed as having MG. Like LEMS, MG is a rare autoimmune disorder that also causes fatigable muscle weakness. While LEMS affects the sending of signals from nerves to muscles, MG affects muscles' ability to receive the signals sent by nerves. Anti-MuSK and LRP4 anti-AChR antibodies are the most common antibodies found in MG patients. Lower levels of these antibodies can also be undetectable, causing a seronegative result, making it even more difficult for clinicians to differentiate between LEMS and an MG diagnosis. Using a blood test, your doctor can identify whether you have antibodies associated with LEMS or those with MG. To ensure an accurate diagnosis, blood tests should be administered in addition to electrodiagnostic and physical tests. Additional testing may occur to confirm or rule out other conditions. Speak with your doctor about potential testing.